To differentiate between these two illnesses, hypothermia occurs when the body's temperature lowers down below its normal levels, which is 37 Celsius and 98.6 Fahrenheit. On the other hand, hyperthermia is when someone's body temperature rises above normal levels. Hypothermia has different levels of severity. Here are some suggested ways to treat them. With mild hypothermia, have the individual change their wet clothing and wrap them around with an insulated material, such as insulate vapor barrier or foil wrap that is about 2 to 3 meters long. Give them hot drinks to get their insides warm as well. Give them about 30 minutes to get the blood circulating. If they are uninjured, have them do some light exercises to further increase their body temperature. With moderate hypothermia, people tend to become less conscious and have stopped shivering. Be careful when assisting individuals in this stage, as they are prone to heart problems due to the cold. To help, have them change their wet clothing. Insulate with insulated vapor barrier or foil wrap and a sleeping bag to fully encapsulate them. Have external heat sources on them, such as heat pads in places like the armpits and neck. With severe hypothermia, they will most likely be unresponsive. Care for these people should be handled very gently to prevent cardiac arrest from occurring. As always, change the clothing into dry ones and cover them in layers from head to toe, except their face. Call for external help so that they are taken to a hospital as soon as possible, because now it's all about monitoring their heart. Now, when it comes to hyperthermia, it also has levels until it can be considered severe. The first level is heat cramps. When an individual complains of cramping in the area that cannot be relieved by stretching, to alleviate it, the person should be moved to a cooler area and get hydrated with water or an electrolyte drink. Heat exhaustion can be seen when someone is sweating profusely, has pale skin, and a rapid heart rate. To help reduce more risks, have the person get changed into loose clothing or remove them. Try not to pat the sweat away, as it can help cool them down. Carefully pour or sponge some water onto them in front of a fan. The most severe is heat stroke. Some of the symptoms to look out for are mental confusion, unconsciousness, and shock. The treatment is fairly similar to heat exhaustion. Change to loose clothing, get the body into cool water, have a fan nearby, but a key note is to get their temperature back to normal within a 45-minute window. This will lower the chance of them getting into more severe state, which would be death.